recording in progress message, and then it'll ask you if you want to stay or go. Of course, we hope you decide to stay, but if you do decide to go, you'll be able to catch the recording on Zoom. Okay, we're going to do one more minute and we'll get started at 12:05 here, because I know Brooke's got a lot of great information to share with us. So we're just going to take one more minute and then we'll get going. And then as additional people come in, since there are always some people who come in a little bit after the 12 o'clock start time, I will be letting them into the room.
And remind me, Carrie, how much time do I have today with you all?
You have got a whole hour. You can use as much of it as you'd like. You don't have to use all of it. We like to save some time for questions and answers at the end.
Okay, great.
But you can feel free to use as much of it as you'd like. Okay, it's 12:05, so we are already recording here, and we're going to go ahead and get started to make sure we've got plenty of time for Brooke to talk about all of the wonderful things she's going to share with us today. So really quickly, we are PAFC, and today we are talking about creating healthy communities, and we have with us today Larimer County Health and Environment, and I'm super excited that we are going to get to talk about some processes today. We're going to be talking about the path to building healthy communities. And what's so exciting for me personally about this topic is a lot of times we are focused on outcomes that many of us have in common that we want to see in our communities, but some of us are not as familiar with the processes to get there. So I really think that this is going to provide a nice framework for understanding how community members come together and really engage to actually create these healthy communities that we all want to live in. I think it's exciting to learn about those processes. We want to let you know how PAFC is helping to make this happen. And what we are looking to do is connect community members with all of the different resources that Larimer County offers. We are also helping to incubate programs where that incubating is needed. So, sometimes there might not be a program in place yet that actually addresses a lot of community members' needs. And we appreciate being in a position where we can help create those programs and then have them kind of fly the nest and become their own entity within the community. We also are trying to create opportunities such as this Lunch and Learn today, where information can be shared with community members and where you've got a space here to ask different questions and really provide your input. We could not do this without our mission sponsor, the Bank of Colorado. We are so very appreciative to the Bank of Colorado for being PAFC's mission sponsor. Could not do it without them. So who do we have today? Today we have Brooke Bettolo. She is the Healthy Community Design and Built Environment Senior Health Educator. That's a lot. You're doing a lot over there for Larimer County, Brooke. And she has some wonderful, wonderful information to share with us today. And Brooke, I'm going to go ahead and stop sharing so that you are able to share your screen. And there you go.
All right, lovely. Is everyone able to see my slides? Great.
I can see them. Yep.
Thank you, Carrie. So my name is Brooke Bettolo. I work for Larimer County Department of Health and Environment. And as Carrie said, I have a very, very long title, but I supervise a program that is funded by state tobacco tax to help increase access to physical activity. So I have a team of about 6. We've got 6 interns also. It's a pretty decently large team. And we work with lots of folks to make sure that they have a voice in how their communities are designed. And also that they have the support that they need to be more physically active. As we all know, being more physically active reduces our chances of all kinds of chronic and pulmonary diseases. And that is what we are funded by the state health department to do. So we educate folks. It's very similar to what Carrie just described in terms of that incubation and promotion of programming. And, we work directly with community members to talk about what they're facing, what is keeping them from being active? How can we support that? What are the barriers? What are the things that do keep you active? What are the things you want to do? And help support them. We create coalitions. We have a program called the Community Champions Program, And that's where neighborhood leaders can kind of come together, host walking groups, talk about the issues in their neighborhoods, and get some solutions so that people can be more physically active and more connected to each other. We also provide data and assessment options. So we will collect data with community members, and then we share that data with the community. You know, it's a community-led process, but then also we use that to inform people from city and county governments to make physical changes to our environment to be more supportive of health, connectivity, and physical activity. So when we do data and assessment, you know, it's a lot of helping them understand what is it actually like to be in these communities and try to move around, and what does it feel like to go on a walk and be on a sidewalk that works perfectly well, and then you get about 20 feet down and then there's no connection anywhere. And how does that make you feel, and how does that keep you from being healthy? And so helping humanize the experience of our residents in Larimer County and saying, hey, you know, this is important. We all know it's important to be physically active, but if they live in a place that isn't safe to be physically active, how are we supposed to do that? What are you proposing? So we have to sometimes use data to encourage them and give them a little bit of a squish and say, hey, you know, this is a really big deal. A lot of people are facing this, and this is your responsibility to help us. And luckily, city planners, county planners are super open to that. They love to hear from the community, by the community. So for us, it's really about elevating community voice to a place where they can start making those connections with city and county entities so that their environment is a reflection of their needs. So we do a lot of public outreach in order to do that. You know, we need to find champions. We need to find people who are into this, who want to support this, who have things that they need somebody to hear about. So we do a lot of outreach. We educate people about what our program does, but then also, you know, help them navigate a process. You know, we do a lot of outreach, and someone will come up and say, yeah, ride my bike all the time, but it's just really unsafe in this one spot and I don't really like it. Okay, let's document that. Let's write that down. Let's get you connected to the person in that city that you need to talk to. Because sometimes just as a resident walking around, you don't always know, well, who do I call? Is it the city? Is it the county? Is it the HOA? You know, what is the situation? And so we take a lot of that burden and help make that process easier. And then we teach the residents in your community, your friends, your family, whoever, that process so that in the future, you know exactly what to do. So it's really about that sustainability of the message and how to make changes yourself. And then we work on project development and design review and plan and policy development. So this is very official documents like what's over here on my desk, where, for example, this is the Montava development that's going in Fort Collins. And so, you know, this developer has come to us asking for some support on things like roundabouts. So we'll take that design idea and we'll say, okay, you know, here's what the city says, here's how this goes. We want to make this more accessible for pedestrians, for people in wheelchairs, people pushing strollers, people who need a little bit more space or time to cross a street. You know, here's the considerations that we talk about when we're trying to get people more active. And then we talk to the developer and say, okay, you know, so therefore you need to make a roundabout that looks like this. You need to have a protected pedestrian crossing. There's a light that someone has to push so that all traffic can stop so people can safely cross, and make sure the timing of that light is enough for somebody, a wheelchair user, stroller user, somebody walking their bike across has enough time to cross. So a lot of considerations that we make based off of best practices, based off of things that we hear from other people, and really are involved from the beginning of a project like this. I mean, this land hasn't even been mowed. They have not done anything yet for this. So we're really trying to get in early on to advocate for people's health as soon as building processes start to happen. And then for plan and policy development, you know, these are existing plans and policies that happen. Every city has a comprehensive plan. So those comprehensive plans talk about how the city is going to develop, where it's going to grow into, where houses go, where the people navigate, where the city center is, how much money is going everywhere. And in those plans, they talk about a lot of opportunities for the community to get involved, or they talk about a lot of projects where we have to tell them that they need to get the community involved. Because I think we've all been in the position where we drive by something and they're doing construction for forever, and then they build something and you sit there and you go, well, man, that would have been really nice about 20 feet the other direction. Or, you know, why wasn't that in my neighborhood? You know, my neighborhood definitely needs that more than that. And that's the issue, is that cities and counties don't necessarily know how to engage with the community. They don't know the populations who are going to be most affected by good infrastructure. So it's a lot of those discussions of saying, hey, we spend a lot of time talking to people and getting those people to tell their experience. Let's talk about how we can influence plans and policies and comprehensive plans. And so every time we're reaching out, not only can you hear from them, but that messaging is consistent. Imagine all of you, just because of your involvement in groups like this, you get a lot of communication from a lot of different agencies. And so it's really important that people are consistent across that communication and that they follow up with you. I'm sure you've done a lot of processes where people come in and they say, hey, I need your voice really fast, do the survey, thank you so much. And then you never hear from them again. And then you might hear from someone from the same organization and you go, hey, how did that go? And they kind of look at you and they have no idea what you're talking about. So what we try to do is to instill sustainability. We're teaching city and county entities that need to develop relationships. So that all kind of works together across the spectrum. So for example, we've got our community champions. These women live in manufactured home communities in the city of Fort Collins. We have representatives from about 3 of them. And then a big network of several hundred more that they can kind of connect to, very similar to your volunteer model here at PAFC. And so when they're telling us things, we are also informing the city and saying, hey, here's what we're hearing from the community. We're going to set up a time for you all to chat with each other. We'll provide interpretation. We'll provide the things that they need to be in the space with you. And we're going to have a conversation and you're going to listen. And all of the time, they've been very kind about it. So luckily, we don't really have to strong arm anyone into it. But it's really important for our community members to know that there are people in this city, in this county, whose job it is to listen to them. And especially when it comes to the health of your community, you want to live in a place that is safe, happy, and healthy. You want to be able to walk or bike or use alternative transportation to a place that you want to go to. If you want to take the bus to the grocery store, you should be able to do that. You should know how to do it. You should know when your stop time is, and it should be a safe and accessible place for you. That's not always the case. And so what we try to do is really elevate those concerns of the community to a level that's helpful. So what we also do is we work with our community champions, anybody who interacts with our program, residents in general, on also working on anything related to physical activity and getting them more active. So that whole big systems level aside, sometimes people just need a little support in being active. They need some ideas for activities that work for their bodies. Everybody's biomechanics is a little different. And so we like to, since we're a health department, we have access to so many resources in terms of helping people with their health. So we can do cooking classes. We can do, like this is an example where our youth went out to the park and did physical activity and learned about, how health works, how nutrition works, how exercise affects your body. So there's a lot of opportunities for education and then just having a buddy. Sometimes you just want a walking group with your friends. And so our staff is also dedicated to hosting walking groups and getting people started. We have access to a whole bunch of Fitbits, so you can track your progress and see how that's going. And it's just, it's a free program that we're doing. We want people to get more physically active and we want to support them in whatever way makes sense. So one of the things I want to do is kind of get some ideas from you all about just some questions, and then we can kind of answer and follow up with some opportunities for partnership or things like that. But I'd really like to get to know you all a little bit more. So one of the questions I have from you is, what keeps you from walking, biking, or taking the bus to the places you like to go? And you can also pop in with questions about the previous things. So if there's something that came up that you just have an itching question about, let me know, but feel free to participate as you want.
Yeah, and feel free to unmute if you'd like, or you can put a note in the chat and I'll be monitoring the chat as well. I'll say for myself, I don't bike because unfortunately I've had a few family members, not locally, but who have been hit by vehicles while they were biking, and it's just made me skittish. But my husband bikes all over Fort Collins and he loves it.
Thank you for sharing. I'm so sorry.
I don't bike just because I don't bike, but I love to walk, and I do live in a neighborhood where the sidewalks are level, the corners have easy access for wheelchairs, etc. But I do know there's a lot of areas where the sidewalks end and people have to walk on dirt. And for older adults who aren't real steady necessarily, that's a problem. And I used to take the bus, just on principle, but with COVID, I'm still COVID shy about taking the bus.
Absolutely, totally understandable.
So I love to walk, and my neighborhood has a lot of different little walking areas that are really well maintained with sidewalks. So I do a lot of that in my neighborhood. Biking, I have not done because I am scared. I don't want to get hit by a car, and I live clear south. South Fort Collins, like Trilby and College in that area. And it's just a little scary for me right now at this moment. And then taking the bus, I've kind of tried to scout out where the bus, where they even go in this area. And a couple of the places I would have to stand to get on the bus are really scary, that are really close to my, well, not really close to my house, but it's on like that Trilby College area. And there's really not a sidewalk or anything. I mean, it's just, you're standing there in dirt. And I, used to see people standing there in the wintertime, and like when the water, like rain, people are swishing them with water and stuff. And I was just like, oh, so I haven't done that. And I am a little COVID shy too. Not going to lie about that. I'm not sure if I want to sit next to a lot of people yet. But I would ride the bus if I felt a little safer with the bus stops.
And we've got a message in the chat as well. Lack of sidewalks and designated areas where I live keeps me from walking more. Also, bike storage and maintenance keeps me from using my bike more. Oh, I haven't thought about the storage and the maintenance piece. Yeah, that can be really tricky for some people.
And I do want to mention that when Max first started, I was skeptical, but I made an effort to ride Max. And I have to go under Troutman, under the railroad tracks to get to Max. So I won't ride Max at night because I'd have to walk to my car. But during the day, I rode Max quite a bit and I really liked it. So if we could just get this little virus out of here, that would be good.
Trust me, we're working on it. We're real tired.
I hear you.
I'm a big fan of the walking trails. We have 3 dogs, so we are always using, it's nice to have also the different parks close to us. That's a big, important thing for me. And then also I do a walking group. And one thing that I can say that I've really appreciated is having so many choices all over town of places to go, paths to walk, and different parks.
So Yvonne, are you doing the walking groups through the built environment?
I'm not, but we should talk. What I am doing is I just have it through Willow Tree. So we just get together and have the walking groups. And then we just meet up at, like, we were at Fossil Ridge Reservoir this week, and next week we'll be like at City Park, and the other week we were down here by the what, I don't know, I call it the Wild Bird Sanctuary, even though it's not that anymore. CSU, Environmental Learning, that one. We've been there. We go all over.
We've got a question in the chat too about how to learn more about these walking groups. So Yvonne, for your walking group that you do through Willow Tree, is there just information up on your website about how people can get involved in that?
No, but I could fix that this weekend. I usually put it on my Facebook. Which is Willow Tree Studios, but I should put something on my website. But since we just do it like primarily in the summer, I just haven't done that.
Got it.
Yeah, I'd like to learn more about your walking groups through built environment or health and environment.
Yeah.
And Willow Tree. I'd love to walk, so.
We'd love to have you walking.
Yeah.
So I put in the chat the email for one of my staff, Araceli Newman. So she is a bilingual native Spanish speaker who's coordinating a lot of the walking groups. And so if you want to reach out to her, I'll dig up her her phone number as well, if that works better for folks. But yeah, so she's the one coordinating those. You can reach out and say, hey, I'm interested. I'm in this neighborhood. I'd like to start a walking group or join one or any of that stuff. And she will be more than happy to help you. She's got one already starting here in Fort Collins. We're going to be expanding into Wellington and Loveland. And so don't worry about the geography. As long as you're in Larimer County, we can make it work. So just let us know. So yeah, so great. Any other comments? Anybody wanted to share their experience with walking, biking, or taking the bus?
I mean, I will say, since you asked, what keeps us from walking or riding the bus or biking to places that we need to go or like to go. I mean, I will say I walk more recreationally, but not so much to places when I'm, say, running errands. And for me, it's just that things are just a little bit too far for that. And if I'm out running errands, I might need to go to the grocery store and to Target and go pick my kid up from camp, where even though we're not a huge city and things are all kind of, within 10 minutes of each other, it's just too much for me to walk or consider biking or taking the bus to get it all done in a short enough amount of time, I guess. So I think for me, the time constraints really play a role.
Absolutely. Anyone else?
This is Nicole. I will reiterate that with kids, we're lucky enough to live on a green belt with the bike path and everything. So we bike and walk to the kids' school, anything off of the green belt, we'll use our bikes or we'll walk. But I would not feel comfortable like taking my kids on a larger road on their bikes. And I mean, it's much better than Denver where I used to live, but still not something that, I keep my kids on that green belt or away from the major roads just for safety. And then, like Carrie said, just honestly, convenience, being lucky enough to have a car and not have to use those for my transportation with kids. It's much easier to do those multitasking type trips in a car than it is with the other modes.
And I'll say that I just do walking recreationally. I don't walk to go shopping or anything like that. I'd be walking a long ways.
They do have that. Maybe we had that on here, Carrie, the bike safety, where they take you on a ride through the city and they teach you about the roadway signs, what they mean for you as a cyclist, and what they mean for you as a car driver. And then also they practice some safety things with you and they teach you how to make some simple bike repairs. That being said, I don't ride on the road either.
Totally fair. Totally fair. Yeah, so those programs that we contract with Bike Fort Collins and we work actively with the city of Fort Collins. One of those rides we're actually doing tomorrow. So we did a bike education class, and that did the kind of ABC check stuff and basic bike safety things and getting people on the bike for the first time in a long time or the first time forever, getting them trained and all of that. And then tomorrow is going to be their ride together where they're going to go across the Pooter. They're going to go on, they wanted to go on streets. They wanted to figure out how to do streets. And so we're going to go in some of those more dangerous places where it's hard to know what to do as a bicyclist. So yes, we do all of those. So please reach out to Araceli or myself if you have interest in that. We will continue doing those. It's a huge passion of ours and a big focus of our work. So please let us know if that's something you want to do. And sometimes too, we might do, just like group walks, we might do group rides as well. So if there's enough interest in something like that, we can definitely do that. I think Lauren makes a good point about recreation versus kind of a purpose visit. It's one of those big lifestyle changes that, oh, I'm going to take the bus to the grocery store. Well, then you get on the bus with all of your groceries and then you have to carry them all the way home. That's not exactly the best system for somebody. And so these are also considerations and things that we talk to planners about. So we say, hey, is that grocery store within walking distance of the housing that it serves? What's around this grocery store? We're building a lot of housing and options in the city of Fort Collins, for example, and there's no grocery store in sight. You got to drive forever. Wellington and other municipalities have the same issue where it's a very long way from any kind of amenity like that. And the route there is not always clear. So a big part of what we do when we are working with the community, they'll say, yeah, sure. I mean, I'd love to be able to do that, but I don't know if that's even feasible for me. And then we kind of walk through and we go, okay, like, what does this look like? If you wanted to do this, what would you have to have? What would you need to do? And sometimes it isn't feasible. Sometimes it isn't safe. And sometimes that, no matter what the connectivity is, it's just never going to be an option. but we do want recreational opportunities to always be available. So these are part of this discussion. And so what you all have talked about is absolutely valid. I mean, these are things we've dealt with for a long time of, you know, accidents, having that kind of trauma in your head of, oh my gosh, this was really bad for somebody, or for myself. I myself as a personal example, same thing. I've led this program and have been part of built environment work for the last 10 years, but I haven't been on a bike since college. So there's a lot of things about everybody recreates differently. Everyone has their own issues with that. And I am doing my active steps to try to get more involved in the biking. But yeah, I'm with you where it's not always about doing one of these modes. It's about finding other ways to be active. Reducing car trips, carpooling, taking the bus if you can, just doing an extra lap when you're just walking around. Sometimes if you're able to do those things, it can make a really big difference overall. But yeah, COVID concerns and things like that, those are absolutely a huge part of why we've had such great discussions. You know, I work for the health department. I spent the last 2 years plus working on COVID response and working directly with residents, and my whole business and life changed over the last 2 years to compensate for that. And so now bringing that lens and all the things that I learned from the COVID response to now, it has been really, really helpful because people don't navigate places like the bus like they used to. And I don't think that will ever go back to how it was. And I think there's a lot of good in that, but I think it's also, you know, our transportation planners need to realize that riding the bus as an economical option, it was something that we could just think about and go, oh yeah, absolutely, let's do that. But with the prevalence of something like COVID, that really gives people pause and going, well, I don't know if it's worth the risk. But yet you still need to get from A to B. And some people don't have the luxury of access to reliable transportation that isn't the bus. So we have to have these conversations with planners and saying, hey, you know, what kind of considerations can we do so that people feel safe on the bus and they feel like this is going to be a healthy experience for them and that they can also do what they need. So absolutely, I hear that 100%, where it doesn't always seem like the best option, regardless of whether or not you want to be more active. It just sometimes isn't safe. Things like individual, so some people mentioned, you know, different infrastructure things related. So that's a lot of really great feedback that we can take and give to planners. So this is why involvement from groups like yours is really important. You know, follow up, send me an email, send me whatever, we have a conversation. And like I mentioned, you know, we can coordinate a discussion with transportation planners, with city staff to talk about these issues that are unique to you, unique to your neighborhood, unique to your family and friends, and in any other interest groups you have, and talk to them about, you know, here's what this is like for us. I have a physical disability, and so a lot of people are not planning for people like me. And so when I navigate a space, it looks very different for me than it looks for someone else. And so I luckily feel confident enough to speak up in some of those rooms and say, hey, have we even talked about this? Is this even on the agenda to discuss, you know, how this affects people when they can't actually physically move in the space like everyone that they're usually planning for? So things like that, where it's about representation, it's about having community voice present in the room. So that's amazing feedback. One of the questions, you know, where do you like to go? What do you like to do with your time?
Hot days like this, it's to the pool, to the reservoir, to the splash pad, to the closest park. All of those places that I love that are so near my home here in Fort Collins.
That's wonderful. That sounds amazing.
Yeah, I second the parks, especially with 2 small children. We love hanging out at the parks. It's very different from the parks that I grew up with in California. We've got huge, vast parks here where I can let go of my kids' hands and see them just run and enjoy themselves. And we've got so much shade built into the parks too. We love the parks, especially during summer.
Well, I just like getting outdoors, you know, and walking, fairly easy walking at this point in my life. No more mountain climbing, but just getting outdoors and just relaxing. I think it's just relaxing.
That's one thing that's so great about, you know, living in this county is you can get outdoors and you probably don't have to travel too far from your home to have easy access to a really nice, just outside space where you can just enjoy being outside.
I also just love being outside, period. So any way I can do it, yay. I love water too.
Wonderful. Oh,
Yeah,
Yvonne, go ahead.
walking by water, that's one that is big for my husband, who had hoped that he could join this discussion today. But any opportunities to walk near like lakes and rivers and stuff like that, we are big fans of in this house.
Well, I'll second that one.
That was one thing when we moved here about 15 years ago, and the one thing I was really impressed by was all the parks and all the activities going on in them, and the opportunities for people to, you know, to play sports, to do gardening, to be on the trails, to ride the bikes. It was so different. We lived in St. Louis and it was more city-ish, and we had 1-inch bike lanes. If you were a good balancer, you could ride on those. But, you know, having the wider walkways, and I just know like many people you have such a big encouragement to go outside, one, because, you know, just a natural area is close to so many people. And for me, getting out and just walking my dogs, then it also gets you a chance to interact with all your other neighbors who are out walking their dogs. But that's really nice, because you feel safer walking around in your community when you have those paths through your neighborhood, I think.
I enjoy that too, Yvonne, and it makes me laugh because I think my neighbors recognize my dog more than they recognize me. She's very friendly. But it is a good way to get to know your neighbors too, and just sort of be familiar with where you live.
Y'all make my work easy. This is wonderful. Yeah, and going, all of these places are excellent mentioning, and I think you brought up some really good points. You know, things like youth access to spaces. You know, taking your kids, taking your grandkids, taking, I don't know, whoever's in your family that's young, to places and going and having splash pads, having the amenities for them to be excited and be cool on a hot day, and all of these. You know, it's so incredibly important that our parks and recreational spaces are reflective of our needs, and that they're nearby, and that they're accessible. And that is a big part of the work that we do, especially with municipalities like Wellington, where they're really just growing and growing and growing, and they need amenities now. And so we try to help inform their staff and find the financing for things like that. Whereas, you know, City of Fort Collins has really established themselves as one of the healthiest communities in the nation, and it's a big priority of theirs to have green space, but there's a lot of room to grow as well. And so that's a lot of what we do, of saying, you know, hey, yeah, there is an amazing park. However, it's super unsafe. And I'll give you an example here in just a few slides about what that looks like for a community here in Fort Collins. But having these activities, these are wonderful. It sounds amazing. And so we want everybody to have that privilege of being able to go out and recreate, or get out in the sun and, you know, travel wherever they want to go. So these are wonderful things to do. And I'm so glad that you understand, you know, it's so connected to our mental health. It's connected to our physical health. It allows us to connect with each other. You know, a lot of you talked about talking with neighbors and that sense of community cohesion, where you're like, I belong here. These people know me. They know my dog better than me, but they know me. And I feel safe walking my dog out here. And I feel like when I'm outside, you know, these people are here for me in that way. And it creates that sense of welcoming that is sometimes really hard to come by. And so I think it's great to build that kind of reputation with your neighbors and have that opportunity to bond with them. And so we want all of our residents to be able to have that. So then the other question being, so we talked about, you know, what are your barriers to being physically active? So how do you get around, you know, when you have to go to the store, when you go anywhere, you know, what is your primary mode of transportation?
And there was one more question in the chat about the inclusion point that you just brought up, Brooke, about whether low income and homeless populations are really getting that information that they need, and what access to that information looks like.
Absolutely. So as to people receiving insufficient incomes, that's the main focus of our outreach so far. We've historically worked with older adults, we've historically worked with youth, but our main focus has been predominantly Latinx folks who are from manufactured home communities who are receiving low incomes. That has been the primary audience that we've had, because we know that access to cars is even limited, but where they are able to afford a house is not anywhere that's accessible. And then a lot of folks are dealing with issues where they don't necessarily know how to ride a bike. So yes, that is 100% always been there, will continue to be our focus and always available. For people experiencing homelessness, I think that is an area that we have done a lot of kind of community engagement several years ago, and then COVID happened. And so I think it's time for us to reinvigorate a lot of those relationships, but we have really partnered actively with Murphy Center, with Matthew's House, with different agencies that provide support. It used to be called Homeless Cured, I forget what it's called, but the gentleman that goes out and repairs bikes and things. So we have a contract with Bike Fort Collins to do exactly that. So we just had an event last week where we did bike repair, and I mean, it's hard. I mean, you don't really want to ask people that question necessarily or profile in that way, but some of the denizens of the park area coming in and getting their bikes repaired is a really common thing of those events. So it's open to everybody, and us as a health department, all of our programming is open to everyone, regardless of status, regardless of a lot of factors. So we as a department definitely favor having equity in all of our programming, and so we are no exception. We definitely want folks to come. So the part for us is building that trust, building those relationships, establishing groups, making sure that we're consistent, and working with other agencies. You know, Kat is having some great questions and great opportunities for connection in the chat. So these are things that we want to do. We want to partner with other agencies that are doing this well, see if they need any support. And if they don't, then we can help them advertise. We can help support that work. We can spread the word. We go to a lot of events. We talk to a lot of partners, and we can say like, oh yeah, let's talk to UC Health. They've got some options. So these are all wonderful connections and insights. But yes, absolutely. Our grant is funded by the state, as I mentioned. And so our focus as a grant is specifically on what we call historically marginalized populations. So these are folks who don't really have access to plans and policies and going to city council and talking to people about things. You know, these are folks who are working, who are staying at home with their children. These are folks who don't have access to the language that they need to communicate to people in power. So that's a huge focus of ours, is working with people who just don't have a voice in our community and making sure that they do, and giving them the tools and the support that they need. And so I think that's why I really love, Carrie, I'm going to have to steal some of your slides, because I love that model that PAFC has of, you know, you convene people, you incubate them, and then, you know, you create and you work together and you make these things. It's the exact same model that we use. So yes, thank you. Great question. These are wonderful. Keep them coming. You guys are awesome. Okay, so I will jump forward a little bit and talk about, so that kind of conversation is an example of what we do when we do outreach. You know, we talk to people, we get to know them, we talk about kind of where they go. We usually do it kind of in a slightly different order, so I apologize if that was a little confusing, but, you know, we'll talk about, hey, where do you go? What do you like to do? Okay, you know, what's going to keep you from, you know, would you want to walk to the store? Would you want to walk to wherever? Could you take the bus to that place? Could you carpool? And we kind of have those conversations. We also do community mapping. So here's an example of one of our youth helping us with some mapping activities with community, where the question that day was, are there green areas near where you live, and what are they, and do you like to use them? So you could literally have a conversation with them right there. They say, well, my house is here and there's a park right here, or no, my house is here and the park is over there. And so we can talk about, okay, you know, what would you like to see? Where would you want that park to be? And then we can take that information and we can give that to our friends who are planners and transportation planners, city planners, land use planners, and tell them, hey, you know, when you have vacant plots of land, when you're redeveloping an area, here are the things to consider. Here's what we've heard from community in this area, and here's how to get a hold of them so that you can continue that conversation. So we're always trying to close that feedback loop so that everybody knows where everything's headed. We also do bike walk and bus education. So some folks mentioned this as well in the chat. So we all of the work that we do is driven completely by the community members that we work with. So our community champions, our youth, the folks that we meet at outreach events, those are the people who determine our work plan. So in recent history, what we have been working on specifically was we administered some surveys. We got a lot of really great feedback and said, what is it you want to do to be more physically active? And they told us that they wanted to bike and bus more, but they just didn't know, there's a lot of barriers to doing those things. Maybe some folks didn't have a bike. Maybe people didn't know how to ride the bus, things like that. And so we talked with them a little bit more about, okay, well, what are the barriers? How can we overcome those? Are those things that we can help with? And so as a result, we did a lot of transportation trainings with the city of Fort Collins. We did a busing training, just like I think PAFC was a part of this. This was quite a while ago, doing the busing to Denver. So we were part of writing that curriculum. We translated that curriculum into Spanish, administered that with a Spanish speaking population as well. We did transit trainings, just having the bus come and doing a little short ride. So we just took a bus out of service and did a little trip, talked about the system. We talked about the MAX. And then we created a bilingual video that talked about how to ride the MAX. Right now with fare free, it's great, you can just jump on, but at the time, they were asking for fares. And so you needed to be sure, when on the MAX, the bus driver isn't collecting your ticket. You have to pay for your ticket when you're at the station. And some, a transportation security officer might come up to you and ask for your ticket, and you may have assumed that the MAX was free at the time. So there's a lot of conversations about that of like, okay, and here's how you buy the ticket. Here's how this works. Hopefully they'll be able to keep that fare free, and that doesn't have to be a confusing barrier to some folks. But we were able to do that. We were able to do that in English and Spanish and get that recorded so that other people could train each other how to do it. We also do bike rides. So like this weekend, we go to trails, we go on the streets, we go wherever our population wants to go, and we partner really effectively with other bike advocacy organizations so that those can continue on into the future. And then the walking education, so walking things, so things for walking groups, but we also do something called walking audits. And I'm not sure if any of you were able to go to the walking audit that the North Front Range MPO had just recently done. So a walking audit, for those who may not know, is you go on a walk and you are evaluating. So you have kind of a sheet or you have directions and instructions that tell you what to look for. And most of the ones that we do are based on infrastructure. So, okay, you got to this sidewalk. Take a picture of when that sidewalk discontinues, or if there's a pothole or there's an uneven bit where the tree roots have grown up. Those kinds of things. And those are all impediments to people being on this particular sidewalk. That's going to catch on a stroller wheel or a wheelchair. Someone's crutches is going to grab on that tree root, those kinds of things where we're evaluating the walkway. And then we give those results to the developer, the people in that area, city planner, whoever's the appropriate audience, to give them that feedback and saying, hey, we looked at this road and this needs help. Here's what you need to do. And so it helps them get that information. And like I talked about in the beginning, a lot of the planners and city staff that we work with, they just don't know your perspective as residents. And so this is really just humanizing that experience and telling them, this is what we need. This is what this feels like for us. From your eye, from the Google, from the Google Maps view, this all looks fine and connected. But when you're actually on the ground, this is not safe. And I don't want to drive, I don't want to ride a bike on College Avenue. That's not safe for me. I want to take a trail that's scenic and beautiful, and there's just not a good connection. So these are the kinds of conversations that we have. So audits, wow, just missed my page right there. So that was the photo of the infrastructure audit that we did with PAFC, hop, skip, and several years ago. And then civic engagement. So sometimes when problems and issues come up, this involves the civic process. We involve, everything with the city takes a policy or someone saying yes. And so we were able to install a volleyball court that the community of Hickory Village wanted to install into Soft Gold Park, because they said, yeah, this is a beautiful park. It has a lot of resources, but we don't go there. It's not safe for us and doesn't have the activities that we want. And so as part of some of that, we helped them install this volleyball court, had a lot of really great fun with that. And then we were able to have a big community event celebrating that. So that civic process is not always straightforward, which is why we use our staff time to help support people and then train them and make sure that they have the skills that they need moving forward. So that's a couple examples of that. And like I mentioned, things about mapping. So those maps we can send to planners, we can send to anyone and say, okay, here's what we're seeing and here's where we're seeing it and here's where connections need to happen and why. And that helps a lot with that discussion of, okay, well, where do we need to put these new streets? We've got a new plan. We got to prioritize where the streets go. And we go, here you go. Here's where they all need to go. So it helps make their jobs easier as well. So this is one of those tools that we use to talk about that. So this is what we have. It's called the Multimodal Index. So this is several different sets of data that help us show planners and decision makers, other agencies, why we do the work we do in the areas that we do, and then also where they should be focusing outreach and engagement, but then also where they should be putting in infrastructure to help people be more active. So the red areas on this map, or the darker areas for those who aren't able to see the color as well, these darker areas are places where we know are incredibly unsafe to be physically active. There are high crash rates, you know, so even if you're trying to get on a bike, if you can find a place, you're more likely to be in an accident. These are places where we know the people who live in these areas don't live as long as everyone else around them. And there's a big connection between their lack of access to these resources and their lifespan. And so this document shows our planners, hey, you know, when you're putting in new infrastructure, don't focus on these light areas, these white and these yellow areas. Try to focus on these orange and red areas where we know there's no infrastructure at all. And there's a lot of people who live here, and so they need support as well. And what we help them with is working directly with community members, which is why we're doing so much outreach and engagement, is because we want to hear from you all. We want your voice to be heard, and we want you to be able to advocate for changes in your area, because planners don't know to come to you. And we're helping them make that connection and build relationships with you directly. So those are the tools. This is another version of that map that's for the city of Loveland, in case we've got some Loveland residents going on here. So you can see there's really only one high access area here for, and I believe that's kind of the downtown area for walkability and bikeability and taking the bus. And then these areas around here may not even have bus routes. There may not be good connectivity. There's high crash rates. And then there's also high rates of things like obesity and diabetes. So an example of things that we have done for residents and with residents is that park I mentioned where the volleyball court is at. That's Softball Park in the city of Fort Collins. It's off of Hickory Street. And they have this beautiful, wonderful park. They've got new amenities to it, but getting there was really unsafe. And so for the residents that are right next to the park, yeah, you can just jump over the fence or go through the gate and have an option. But for people who are traveling from somewhere else, they have to get onto College. They have to turn onto Hickory Street. The left turn wasn't safe. You can't see past that. So you could maybe get yourself in an accident just trying to get there. And for those of you that know where the Family Center is, this is that same street that has that. So as you go towards the park, they also did a traffic study for us. So we said, you know, hey, there's a lot of traffic. People are complaining about speeds too fast. And when they did the traffic study, they found that the highest speed that someone went on this road was 95 miles an hour, and the speed limit is 25. So lots of problems in terms of people trying to navigate the street. It's super wide. There's not really a lot of visual obstruction. And so people think that they can go just as fast as they want. There's a railroad crossing there that doesn't have any crossbars. So you have to stop and you have to keep an eye out and then go. And even when people would stop, and a lot of people didn't, even when they would stop, they would accelerate to over 45 miles an hour within the first 20 feet of that intersection. So very concerning, lots of issues with that. So what we were able to work on with the city, so it was a big process, took several years. We had to get city council involved. We had to get a lot of folks involved. But we had them do what's called a road diet. So they repainted and repaved that street. And then they made everything smaller. So they made the lanes smaller, and then they added bike lanes. They gave a little bit of a buffer between the bike lane and the sidewalk. They fixed some issues with the sidewalk that was happening. And then eventually they will be installing speed bumps to help with that speed issue. Another thing that we installed was this art installation. So this was an asphalt art installation the city of Fort Collins worked on with Bike Fort Collins and did engagement with us to get the community members to help plan the art and paint the art. So this is the kind of partnerships that we do. You know, we do them across several organizations. We work together to find solutions that are going to work for communities and help them find something. And so since then, people they see that art and they slow down. They go, what is that? So that helps them slow down so that people feel more safe accessing the park. So just to give you a kind of overview of what we do, I know we don't have a ton of time, but feel free, you can always reach out via email. You can give me a call anytime. But are there any pressing questions that you have for me?
I just love hearing how it all comes together, like the example that you just gave, Brooke, of the street art and all of the different entities that were involved in that. I feel like it creates a solution for that situation, absolutely. But then it also just creates such a sense of community. bringing all of these people together and seeing how they all worked together to create this beautiful art that in turn was part of a solution. I love that you're not only creating solutions that impact how easy it is for people to be able to live a healthy lifestyle in this county, but you're creating a sense of community along with it. And I just think that's really special.
Thank you, Carrie.
Thank you. I get so excited about this stuff and about learning these different processes.
I just want to say thank you so much for educating us on everything that you do, because that is a lot. And so it's great to have this information to our community. So I appreciate that. And I think I should have looked at that map before I bought my house.
Oh.
I'm like, oh my gosh, lifespan's shorter where I live. That's not good. Sad.
That map is really interesting. It's interesting to see the little pockets where there has been some needed advances to create these healthier communities, and then where there's still a lot of work to be done. But what I love about this too is, for those who could not attend today, we put this up on YouTube, and it really inspires people to get involved in those particular communities. I mean, I can think of a few people whose names I'm not going to mention, but just offhand, who I know, if they looked at that map, would say, aha, right there, we have a need. How can we get involved in trying to make a difference in this particular pocket that really, has some needs that still need to be addressed? So I think it inspires people. This is one of those great examples, Brooke, where getting that information really inspires people to participate even more in their communities and help make a difference and really feel like they're making a difference, because you get involved and then you see the change actually happen. I just think that's so motivating for people. So thank you so much for all the detail that you went into and all your great visuals. I think seeing it, I know for me, really helps me absorb it and understand it all better.
Absolutely. Very happy to be here, everyone. So yeah, there's my email there. Put it in the chat as well. Feel free to follow up. Carrie also has my contact information. And yeah, we'd love to see you as part of our walking group. We also have other coalitions that work on this. We have lots of opportunities to get involved. We also have a newsletter that goes out that you might want to sign up for that has other opportunities. So please keep us in mind. And we'd love to hear from you and all of your unique perspectives on how we can do this and support you to have a more healthy community. So thank you so much for the time. It was lovely to meet you all. Thank you for the great participation. It's wonderful to talk to folks who get it, who want to work on this as well. So thank you so much for your time and your expertise. I appreciate it.
Thank you so much.
Brooke, we just did a walking audit at the Foothills Mall area. Would you like that information?
So we did that in partnership with them.
Oh, okay.
Yeah, so we used our toolkit to do that.
Okay, good.
Yeah, so I'm sure someone somewhere has the results. If they don't, I'll be calling you up.
Yeah, great. I did not know that.
And so if you liked that, if you enjoyed that process and you want to learn how to do that, we have all of the tools that we taught them and would be happy to pass that along. So yes, please, we would love to do that.
See, partnerships I don't even know. So
I know.
Wonderful. Thank you so much, everyone, for joining us today. We will get the recording of today's Lunch and Learn up on YouTube. So those who could not join us today will have a chance to view it. And then you all can feel free to pass the link along to friends and family. And thank you again so much, Brooke. We really appreciate you being here.
Thanks, everyone. Great to meet you.
Thanks so much, everybody. Take care.
Bye.